Okay, we're running a little bit behind, so I'm going to jump right into this. Initially, what I'm going to do is tell you about my role as the Ombuds for Salt Lake City. It's a little bit out of the ordinary in response to these type of oil spill situations. But here's my job description. I put it up there just so, one, I could remind myself of everything that I do as we've gone through this process. But I wanted you all to get a sense of the type of job that I have as the Ombuds for the Red Butte Creek oil spill. I'm an independent, informal, confidential, I think that's exceedingly important to my job, confidential resource that advocates for a fair process for people that have been impacted or involved in the Red Butte Creek oil spill. Key to my job is that I'm a supplement, an alternative option to normal channels that people, government agencies, and industry would go through as they're considering issues related to the oil spill. Quite a lot of my job involves personal interaction, and I gather information. I work in a multi-party type of atmosphere. I work, like I said, with all government entities from the federal government to the local government, and work with individuals impacted by the oil spill as well as industry and institutions. Part of what I do is facilitate diplomatic discussions in process, and I review issues, report findings, and part of my job is also to facilitate, mediate, and provide conciliation services for impacted parties. So, as the Ombuds for the Red Butte Creek oil spill, I was appointed by the mayor of Salt Lake City. However, in our early conversations about what my role would look like, I realized, and the mayor's office realized, that as an advocate and an honest arbiter, I needed to have complete independence in my job. So as I'm appointed and as outlined in the scope of my work, I am completely independent. I do not reside even at City Hall. I'm a separate, complete entity from city government. And I do report to the mayor, the chief of staff, and the communications director. However, that reporting is primarily advisory. I'm not in a situation where the mayor, the chief of staff, or the communications director tells me what to do. I often go to them and say, this is a situation that needs to be addressed. I think your people need to look at this. You need to communicate with other agencies, or you need to work directly with individuals. And within the scope of those services, if that's not possible, then I can then intervene. Lastly, in terms of that confidentiality, communication between myself and any individual or entity is privileged, and I do not reveal those conversations unless I have permission to do so, and likewise, other individuals may not ask me to reveal private conversations. So here is our Salt Lake City oil spill, the oil spill number 1. It happened on June 11th and through the evening, all the way into the late afternoon of July 12th. This oil spill was reported by Chevron to have started at approximately 11 p.m. on June 11th and was not shut off until the early evening of June 12th. Because we're talking about health today, I wanted to get right into the health symptoms reported to me, keeping in mind that I am in the alternative. I'm probably not the first person that individuals came to with health-related symptoms. When normal channels were not working in the Salt Lake City and Salt Lake County and the state health department situation, individuals came to me. They picked up the phone and they called me, and this is what they reported. And I've somnolence, that people did not wake up the night and morning of the spill. A lot of people reported to me that unbeknownst to them, a spill was happening through the night as they slept. Keep in mind that it was June. A lot of windows were open, and individuals, adults and children, did not wake up until late into the afternoon. And when they woke up, they had dizziness, fogginess, couldn't quite understand the smells that were going on around them and what was happening to them. Dizziness, shortness of breath, chest pain, headache, case of temporary blindness, syncope. We had individuals that were fainting, respiratory ailments, asthma as mentioned before, vomiting, concentration, bedwetting, and fatigue. These were emergent issues that were called into me within the first 2 weeks of the spill, but they continue to be issues for many people this many months and a year after the spill. Why I've put this as subjective is because this is what is reported from the first person. While public health agencies and the city were very much interested in gathering data, and it's their job to gather quantitative data, this is the first person. This is the subjective issue that I think that we need to be listening to. The quantitative data is important, but it happens, as in Enbridge and in Salt Lake City, it happens quite a while after the fact. The air monitoring that is so important to understanding some of these symptoms does not happen till days later, if it begins at that point, because of the amount of time that goes by from the original rupture to the discovery of the spill. Here's what we looked at, or here's what my office looked at in terms of this health issue. One, first and foremost, based on the experience of Salt Lake City and the individuals that come to me and continue to come to me, I think that in situations where you have an emergent crisis related to an oil spill, we really need to honor the individual subjective reporting. If any of us go to seek medical care for any situation, whether that's a sore throat or impacted by an emergent crisis situation, we are subjective. That is our reporting. And if anyone goes to seek health care, I would defy you to say that you expect to show up and be told that your symptoms are not real until they can completely be quantified before and after the situation. So the subjective is very, very important as we move forward. Objective data is absolutely important as well. When you go seek medical care, you expect to have your blood pressure taken. Any number of tests needs to be run. So we need to marry the subjective and the objective. We need to immediately recommend that individuals that have any type of health symptoms, whether we can say that those are consequent to a spill or that emergency, or maybe related to something else, need to seek medical care. In Salt Lake City, early on, there was a lot of uncertainty about advising people to seek medical care. Early air monitoring said, as we heard in Enbridge, that the toxicity levels were below health concerns and that people were advised to leave if they wanted to. However, it was up to the individual to make that decision on their own. And people spent days and weeks before they called me to say, I have these ongoing health problems. We've had these severe headaches, we can't concentrate, we're having trouble breathing. And when I said, have you sought medical care, have you seen a healthcare provider, the common response was, well, I don't know if this is real. I don't want to be seen as a troublemaker, or I don't know if I should go or not. And I think one of the interesting things to me that I saw happen in Salt Lake City is that amid the confusion and the uncertainty of the event, individuals who are responding to an unpredictable event in their life are relying on experts to tell them what to do. And in some way, just your basic intuition flies out the window because it's unpredictable. It's not practiced, it's not rehearsed, it's not something that you expect in your day-to-day life. The second thing that in Salt Lake City, we have a major medical research institution at the University of Utah. We have very high quality medical services in the county and in the state. However, what I found is that there are not a lot of knowledgeable medical practitioners that deal with this type of situation. And when we talk about the future of completing communities in terms of their preparedness for unknown situations, engaging the medical community early on is very important. And those are practitioners. That's not just the public health agencies, but those are practitioners who may need to deal with environmental health consequences. As I said before, gather objective data, gather it early, gather it often. In Salt Lake City, to the credit of everyone involved, when individuals requested air quality testing, it was provided immediately. Outside consultants were hired. The city retained an outside toxicologist, and she was enormously helpful to our situation. One of the things, though, to keep in mind, it's difficult for those impacted to have to continue to ask. And that's where they could come and ask me without risk of being labeled or being exposed in the community. And I could make those requests and make sure the testing was adequately delivered in a timely manner. And the last thing is, as a consequence of the oil spill, we convened an oil spill work group, and the VOEs were part of that work group. We had 4 teams that looked at oil spill impacts, and health was one of the teams that we looked at in depth, health-related concerns. One of the important things, however, to consider is that all of this happened after the fact. The air monitoring was done at the request of individuals. The oil spill work group was a consequence of the constellation of questions and comments and issues that I was working to resolve, and I felt like we needed to get those out into a more deliberative forum, and in a forum where we could bring everybody as what I call all in, where we had affected individuals, state agencies, county, city, NGOs involved, and we can get into these problems in depth. I'm just going to, how much time do I have? Where are we? I want the VOEs to be able to come up here. Oh, you know what? I'm just going to have Nina and Michael come up and come on up, and my slideshow can be made available. The rest of it's contextual to the area. The most important thing you want to know about Salt Lake City is that this is a highly urbanized area, not a rural area. So Michael and Nina, why don't you just come right up?